Okay, hi everyone. My name is Fatima Calderon, and my study was on childhood socioeconomic status and mental health care access. So, to start off, previous research has shown that minorities receive racial minorities receive mental health services at lower rates than middle and upper class whites. Um, There has also been findings that show that mental health treatment can prevent high mental health and medical expenditures, and that most people with psychological disorders often don't receive mental health care. Um, so in my study, we examined a sample of undergraduate students and people that were asked about their childhood socioeconomic status and access to mental health care resources. I wanted to see who has more access to mental health care, and I also wanted to see if having access to mental health care can predict one's attitude and comfortability in seeking and receiving mental health care treatment. So, my hypothesis was that income levels was one of the many possible factors associated with accessibility to mental health care, and that people with higher income levels have more access to mental health care resources. So, our sample consisted of 314 undergraduate students that were 21 and older. The mean age was 28 years old, and the sample consisted of about 70% women and 30% men. And then the ethnicity that participated the most was Latinx and Hispanic, and then it was Caucasian and white, and so on. And then, so for the procedure, first we started off by asking the participants to fill out a survey asking about their childhood perceived SES, access to mental health care resources, and likability of using mental health care resources. So one of the item examples for measuring childhood perceived SES was, did you have any electronic educational devices such as a laptop, computer, tablet, or Kindle in your home as a child? We thought it was a good indicator of someone's wealth. By asking this, we thought it would be a good indicator. And then for the childhood access to mental health care resources example item, we have, think about yourself during childhood. If you would have had a mental health or emotional problem, I would have known where to get professional care. And then they answered with this response. So they chose strongly disagree, or somewhat disagree, somewhat agree, or strongly agree. So after conducting the survey, these are the results we received. So we evaluated the bivariate correlation between childhood wealth and barriers to mental health care resources. And we found that there was a negative correlation between childhood wealth and barriers to mental health care resources, which indicates that people with more wealth were less likely to have barriers to use mental health care resources and therefore were more likely to seek for mental health help. And this is shown in the graph. So as there was a higher wealth, there was less barriers to mental health care resources. And so figure 1 depicts the negative relationship between childhood wealth and barriers to mental health care. The more wealth a child had, the less likely chance they would have experienced barriers to obtain mental health resources. And for our conclusions, so back to the purpose, we wanted to test the relationship between childhood SES and accessibility to mental health care. And we found that higher SES was associated with higher accessibility to mental health care resources, which confirms the hypothesis of this study. And higher SES correlated with level of barriers in accessing mental health care resources. So in other words, the higher SES had a negative correlation with levels of barriers. And so what we can imply from this study is that minority groups may face more barriers when trying to access mental health care resources. So it would make sense to say that perhaps minority groups may have higher rates of untreated mental illness because they have a have a harder time accessing mental health care resources. And so that leads to the question on how does untreated mental health illness have a long-term effect on minority groups? So one of the limitations of the study was that there may have been inaccuracies because we did ask people about their childhood SES, and well, maybe they didn't remember their childhood SES accurately. Um, so yeah, that could possibly lead to some inaccuracy. And some future directions could be, or some future studies that could take place could focus on how can mental health interventions be instilled in minority communities as they are less likely to access mental health care resources. So overall, what I want you to take from this is that people with higher income levels is associated with having more easy access to and seeking mental health care resources. If you have any questions, please feel free to contact me, and thank you.